A 45-year-old man with a 3-year history of cardiovascular disease has entered the hospital with a stroke that has paralyzed his right side and caused him to aspirate food of any consistency. His mental status is clouded and there is disagreement as to whether or not he has decisional capacity. His language capacity is only yes and no, and his responses are inconsistent. The attending physician is convinced that the patient has lost decisional capacity, while two family members are equally convinced that he has decisional capacity. The patient's wife and two other children are ambivalent about his competency to make decisions. The prognosis for recovery of a safe swallowing and speech approaches zero because of the dense damage to the cerebral cortex visible on brain imaging. Two neurological consultants have verified that recovery is likely to be minimal and that permanent severe disability will be the outcome. The patient does not have an advance directive. The patient's wife says that they never did discuss a preference about life-sustaining treatment. She is convinced that he would not want to live in this disabled condition, but is uncertain whether to request the placement of a feeding tube. Two of her 4 adult children are strongly opposed to the tube placement, while the other 2 insist that not to do so would be to kill our father. The patient's wife is torn between these two positions, but finally requests that the tube be placed.